Welcome back to the second module of dealing with HIV/AIDS in your new venture. Today's second module we're going to be looking at is how is HIV/AIDS transmitted, and here are the module outcomes that we're going to be looking at today. Firstly, we're going to outline the effects of body fluids on transmission of the HIV virus at a basic level of understanding. The second one we're going to be looking at is identify sex as the most common way in which HIV virus is transmitted, and list other ways in which HIV is transmitted with an indication of the conditions necessary for transmission. Then, list the ways in which mother-to-child transmission can occur and indicate the implication of a pregnant woman or girl child having unprotected sex for both the mother as well as the unborn child. Knowing and understanding how HIV/AIDS is transmitted. The most common methods of transmission of HIV is unprotected sex with an infected partner, sharing needles with an infected person. Also, eliminating the risk as factors for HIV transmission is basically transmission from infected mother to fetus, as well as infection from blood products. The effect of body fluids on transmission of the HIV virus. Human immunodeficiency virus is transmitted through contact with a body fluid that contains the virus. The transmission of HIV requires contact with a body fluid that contains the virus or infected cells. HIV can appear in nearly any body fluid, but transmission occurs mainly through blood, semen, vaginal secretions, as well as breast milk. Sex is the most common way in which the HIV virus is transmitted. In much of the world, vaginal sex is the most common way the virus is transmitted. HIV can be found in blood, semen, preseminal fluid or pre-cum, or vaginal fluid of a person infected with the virus. The lining of the vagina can tear and allow HIV to actually enter the body. Direct absorption of HIV through the mucous membranes that line the vagina also is a possibility. The ways in which mother-to-child transmission can occur. Mother-to-child transmission, or MTCT, is when an HIV-positive woman passes the virus to her baby. HIV can be transmitted from mother to her baby during pregnancy, labor, and delivery, and later through breastfeeding. Actions that make HIV-positive mother can take. Pregnant women who are HIV-positive can reduce the risk of infecting their babies by using antiretroviral drugs during pregnancy, but also through labor. In addition, the baby may be given an antiretroviral drug for a few weeks after birth to counteract exposure to the virus during labor. There are different drugs and treatment approaches that can be used in this situation, but the most worldwide experience has been obtained with the drug AZT, and more recently, Nerfine. The danger of drug abuse and behaviour that could result in HIV transmission. Only a very small percentage of the population in South Africa is addicted to drugs, taken intravenously or injected into the bloodstream. Essentially, the virus is spread through contact with contaminated blood as the drug users share hypodermic syringes to inject themselves with the drug of their choice. Precautions used in South Africa to ensure blood products are HIV-free. The danger of HIV products infection through infected blood products has meant that the South African blood transfusion services have had to apply rigorous systems for checking the safety of blood donated by the public. In South Africa, we are fortunate enough to have a competent system of medical care in which sterile syringes and other invasive tools that those cut into the patient are the norm. Please complete class activity 2 in your workbook. Thank you.